Hello there to those of you who've gotten here a couple of minutes early. Thanks for joining our webinar today. My name is Trachtman. As we get started, and we'll start pretty promptly at 2 o'clock Eastern time. As we get started, we're going to share some slides with you, and we're actually going to share a poll with you. Although we're having a little bit of trouble as to whether the poll takes away the video sharing or not. So we may share a poll with you and then, excuse me, then take it back if it doesn't work. But in any case, if you wouldn't mind, if we have a minute or two before, if you would type in the questions box, which is in that gray bar on the side, maybe the location, the city or state that you're calling in from, that would be great. That'll give us a little bit of context as to who we're reaching today. So again, if you can do that in the questions part of the bar, thank you. Great, we're getting some now. Wilmington, Delaware, Toronto, Houston, Texas, terrific. Knoxville, Tennessee. Looks like we haven't infiltrated the West Coast yet, but we're getting across there. Dayton, Ohio. Great. Lots of friends in Dayton, Ohio. And a couple of good baseball teams, one in Toronto, one in Houston. Pretty good. That's good. Terrific. For those of you who are just joining, oh, there's the poll. Would somebody just note in the question box whether they can see that poll or not? Just say yes if you can see that poll that just went up. Perfect, great. If you wouldn't mind, just quickly, because it looks like it did take over the video, go ahead and complete that poll. That'll give us a little bit of a background as to where our audience is with regard to their relationship with second opinions. So if you're just joining us now, please feel free to go ahead and take that poll and to, well, you don't have to let us know. If you take that poll, we'll put the video back on in just one moment. Great, we got somebody from Oklahoma, Indiana, perfect. Joining us from everywhere. Thanks again for joining us. We'll be starting in just about a minute. If you do see the poll up and you're here now and you want to just go ahead and click on your choice on that poll, that would be great. You press submit when you're done, right below that red writing near the bottom middle. And we'll go ahead and correlate the answers and we'll report back to you with what we've got as we get started with the webinar. Okay, I think we're going to go ahead and transition over to the webinar. I don't think the poll can stay up while we're doing that. So if you haven't finished answering the poll, go ahead and quickly do that. And then we're going to take it down and get started with the rest of the webinar. All right, go ahead. Thank you. Pull that down. I don't even have to ask. You guys are great. Thank you very much. Terrific. So it's a couple minutes after 2 on the East Coast. There's the answers to the poll. So we've got a lot of people in the early stages, just learning, exploring solutions, a couple of you that are implementing, and about half as many as that have programs in place, or in fact, not interested. I guess they're just here to see our panelists, which is fine. Happy to have you do that. We've got some great panelists today. Okay, thank you for sharing that. So for those of you who are just joining us now, thank you very much for joining. My name is Trachtman. I'm your host for today. I'm not one of the esteemed panelists, but I get the pleasure of introducing the panelists today and posing some questions for them. First, I just wanted to make sure that I acknowledged tonight is the beginning of fall. Some people really love fall. For me, I sort of mourn the end of summer, but this year at least I'm not mourning because it's fall and the Mets are still in first place. That's a unique thing. But more important than that, this is National Telehealth Week. So it's nice to have this webinar, which is a component of telehealth, correlate with National Telehealth Week. So as we get started, I wanted to give you all a few ground rules. So first of all, we have quite a few attendees today. So all of your mics will be muted for the entire webinar. However, we do accept audience questions. If you do have a question, you can type it in that same bar that you've been putting those comments and letting me know where you're from. You can put questions in there. We will try to wait until the end of the webinar to ask those questions, and we'll raise as many of those questions as we can. And there's a good chance we're not going to get to all of them, but we'll do our best with that. This webinar is being recorded. That's for your benefit. You will all get access to a link to be able to see the recorded version of this afterwards. And for anybody who hasn't had a chance to attend this webinar live, they'll be given an opportunity to see that link as well. You can share it with your colleagues. It's a well, I don't know if I say it's a non-secure link. I don't like to say non-secure in front of anybody in the medical business, but it's a link that you can share with others. If you stick around till the end, we're going to tell you about some cool parting gifts that we give to the audience. And this webinar, including all the questions and answers, will last no longer than an hour. So we'll be done by 3 o'clock Eastern time today. So with that, let me quickly go ahead and introduce the topic, and our speakers can join us, please, as I'm doing that. Today's webinar is about children's hospitals and how they're considering standing up a second opinion practice as part of an overall telehealth strategy. As all hospitals and everybody in the healthcare business begins to adapt to what we hope is a post-COVID world. There's also increasing acceptance, maybe because of COVID, of telehealth as a component of the delivery of healthcare, and a, unfortunately, increasing challenging financial environment for all hospitals, and including children's hospitals. I did a little research before this, and there's some guidance given by Huron Group, which is a leading management consulting firm, and their study of the children's hospital marketplace. They quoted as saying, improving customer access to non-urgent care supported by virtual care, topic of this webinar, and digital tools, will continue to define the future of children's health systems, with significant opportunities for growth, patient loyalty, and consumer satisfaction. Providers should consider expanding their brand strength for specialties to grow beyond their immediate geographies by expanding initial consults and care needs that may be better managed remotely or in a hybrid environment. And I'll couple that with the NRC Health, who did a study and said in their 2022 Pediatric Consumer Trends report that an all-time high of consumers, well over half, report visiting a pediatric website in advance of a visit to the facility. So with that backdrop, let me introduce you to today's panel. I'm really excited to introduce these panelists. They are from some of the top children's hospitals in the country. With us today, in no order of how they're appearing on my screen, I don't know how they're appearing on your screen, are Laura McLaughlin, who's the Telehealth Program Manager at Nationwide Children's in Columbus, Ohio. Welcome, Laura. Vanessa Swickline, who's the Senior Project Manager of Telehealth at UPMC Children's Hospital of Pittsburgh. Hi, Vanessa. Megan Howard, who's the Senior Manager of Strategy and Innovation at Texas Children's Hospital. Hi, Megan, good to see you. And Corey Morrison, who's the Senior Program Manager and Strategic Marketing Professional at Cincinnati Children's Hospital. So thank you very much for joining us today, and welcome. As we go forward, I'm sure you've got lots to share with this audience, and they're very eager to hear what each of you has to say. So with that, let me get started. I thought what would be great would be to set a baseline. So if you each wouldn't mind sharing with us, where are you in your and your hospital's journey into reviewing second opinions as a component of your overall telehealth strategy? So Vanessa, you're in my top left right now. It keeps switching. If you wouldn't mind starting out, love to hear what you have to say.
Yeah, not at all. Thank you for having me this afternoon. It's great to be here. So here at UPMC Children's and in our system as a whole, we are currently evolving. We have a second opinion program in place, and at this point looking to see what we can do better and how we can make it a little more robust and touch a few more patients than we're currently touching.
Great, thank you. And I love your background. Nice advertising background. We're not nearly as innovative as you are. But thanks. Laura, you're next up for me on my screen. Would you mind sharing what you're doing at Nationwide?
Yeah, of course. Very similar position to Vanessa. We're looking to expand our second opinion program and really make it as easy as possible for both patients and providers to have that communication back and forth. So we're looking at really building out new workflows and tools to support that. We hear from our providers that that's a huge need, and so we're trying to meet them where they're at.
Great, thank you. And Corey, you're in the middle of the bottom of my screen, so you're next.
Okay, we launched our program officially in March of this year, and much like the others, we are looking to grow our program. I think it's just figuring out the right ways to communicate with families to meet them where they are.
Great, thank you, Corey. And Megan.
Yeah, thank you. We are a little bit earlier with a system implementation. So right now we have a lot of second opinion solutions that exist in certain departments, certain areas, certain provider groups. But right now we're really looking at how we can systemize this process to make sure that we are meeting the needs of our patients consistently and also able to track and measure so that we can manage.
Great. I think that theme of track and measure is going to come back a few times, perhaps in this webinar. We hear it all the time. Great. Thank you for setting that baseline. So now the audience can understand where each of you is coming from as we get into some more of the meatier questions that we're going to get to today. So I'm going to try to continue to circle around. So Laura, if you wouldn't mind being the first one to respond to this one, and if anybody has any comments about Laura's, feel free to jump in as well. This doesn't need to be structured. When Les calls on you, you can comment. It doesn't usually happen in the rest of our relationships that we've had. So feel free to jump in when you want to. But Laura, in your organization, where do second opinions fit? And I know you have a lot of responsibilities around telehealth as well there. So give us the lowdown at Nationwide, how that fits together.
Yeah, I think we see telehealth as really a tool for our clinical programs, right? It's not something that stands on its own. We're not just a standalone service line. So when we look at telehealth, we think of it as ways that we're connecting patients and providers to each other, right? So you could always have an in-person visit, but telehealth is expanding our capability and expanding our access to meet both patients and providers where it's most convenient for them. So what I think we found with Second Opinion is the ambulatory health that we really started doing with COVID, right? The clinic visits are a little bit different breed. So when we started getting deeper into Second Opinion, we realized the needs are very unique for this patient population, right? It's not just a one-off visit. They're really seeking specialized expertise. There's a greater need for medical record transfer. There's a different type of communication that's happening with the patient and provider. So still a form of telehealth in our minds, but the tool set that we need and the workflow that we build around that looks very different. And even from the point of marketing and consumer access. So we felt it was really important to stand up a dedicated program for this and really look at the unique needs of both patients and providers in this population. So it still fits in that portfolio, but I think we recognize it as a really distinct group.
Great. Corey, you're next up on the list, and it sounds like from your introduction that probably your program is well, between yours and Vanessa is probably the most mature in terms of its duration so far. So where does it fit in your organization?
Our program actually is housed within the Center for Telehealth, but when we were building the program, we pulled in other, I'll say, consultations from groups from all over the hospital to make sure that as we were building our program, the voices of different groups throughout the hospital were around the table, and we were taking their thoughts into consideration as we were building it. But because it is the way we have our program structured is an asynchronous interaction, it very nicely fits within the work that we do within the Center for Telehealth.
So could you just go a little bit deeper on the asynchronous side? Why does that matter, and why does that differ from the rest of what you do?
Well, I think that one of the benefits of COVID, if I always like to be the silver lining type of person, is that telehealth became a household word. Everybody knew. For the first time, my family understood a little bit about what I do, but that became synonymous with a video visit, and so a lot of what we do in the Center for Telehealth is video visits, but it's so much more than video visits. It's how can you use technology in a way that hasn't been used before to meet the needs of patients and families. It's really pushed everybody to be more creative. And online second opinions is telehealth. It's asynchronous in that there's no direct or live real-time interaction between the patient and the family, but it's all done remotely. So I guess that's really the heart of your question was, how is it different? We do have other types of asynchronous telehealth that takes place within the Center for Telehealth, but this was kind of our first foray into that.
Excuse me. So not necessarily video in the remote second opinion world.
So our remote second opinion, the product or the end product for the family is they get a written report that is shared with the family as well as their local provider. There's there's no direct contact. There's not a video visit exchange.
Got it. Okay, great. And Megan at Texas Children's, I know you guys are just in the early stages, but architecturally, have you figured out where you want this?
Yeah, so we are thinking about it just a little bit differently. And I think it's because we're really trying to focus on the patient experience. And because of that, you know, while our telehealth group would drive a lot of this and everything else, we're trying to think of it more from a perspective of access. So as we think about how people are engaging with Texas Children's and the variety of options that they have, how can we make sure that we're getting people to the right resources, which can be kind of challenging, right? And I think that as we went through COVID, and Corey, to your point, as there were more and more options and people became more familiar with them, I think one of the things now is to make sure that all of that access is a little bit more digestible. So for that reason, we're kind of taking the perspective of our patients and thinking about it more in that general access bucket.
Okay. And Vanessa, I know your program is a bit different. Where does yours fit?
Yeah, so a little unique and touch a little bit on what Laura and Corey are both doing as well. We really started our second opinion program really touches 3 different buckets. So international as well as telehealth and our ambulatory services. And our second opinion program existed before COVID, when there were a little bit less rules internationally than there were domestically. So we were able to touch some patients internationally, and our hopes were that potentially provide them with the guidance or get them here to our hospital to better serve them. Excuse me. With that, though, came the need for access and how do we reach more. So there are certain ambulatory services, for example, dermatology or perhaps infectious diseases that we do asynchronous. Like Corey mentioned, there are others that we will do asynchronous visit, but ultimately in the end, it ends up culminating with a written report.
Okay, great. So if you wouldn't mind, and I don't want to put you on the spot for this, but if you wouldn't mind drilling down a little bit into you said there was an impetus to do international because there were less rules, less regulatory restrictions, I guess is what you're referring to. Can you give us a little more flavor of that?
Sure, yeah. So the way that this program started internationally was that our expectation was that a second opinion came requested from a physician in whatever country said patient might be in. And with the request from that physician, it was physician to physician as well as the patient being involved, so that number one, there was a complete understanding of the medical jargon being exchanged as it relates, but also someone there that sometimes these are really hard diagnoses that are being delivered, right? And so having someone there to also have that compassion in person was also really beneficial. So we were able to take that and we have sort of worked that to become more domestic now that things have opened up.
Okay, great. And I know there are challenges domestically. The whole idea of licensure in the United States is really done on a state-by-state basis. So that is challenging, but I know that each of you have approached this, and I know your legal teams have to think deeply about this. Is that, I don't mean to ask what states do you do business in, but is that overly restrictive for you, or can the program truly see the light of day with the correct controls and the right legal guidance? And Corey, you're gonna, if you don't mind, you're the one who's going to start this one, or you've been picked to start this one, if you so desire to answer the question.
So I think that it's fair to say that pediatrics tends to be a little bit more conservative than adult health care. That's not necessarily a bad thing. And Cincinnati is obviously in the Midwest and also conservative. So it's not surprising that our legal team would have a conservative approach. But we had a really good partnership when we were looking at the geographies that we were going to offer this new service. And we whittled down our list, and I'm happy with where we landed. We don't have too many states that are excluded. Hope to continue to be able to push on that to get even more. But I think we landed in a good place. And it's there are some states that prohibit that type of provider to provider interaction. So, you know, those are things to be considered as well. But I think we landed in a pretty safe place, and we definitely talked to colleagues around the country who already had programs to see what they were doing. And I feel like everybody's in the same boat. Everybody started with the same long list and had whittled it down probably to the same state.
Great. We do hear progress being made in the marketplace. There are some states now that have actually come out with laws that are carte blanche laws for doctors to practice from anywhere into their state, which is great. I think there's like 17 states now that have done that. We all know about IMLCC, which is a bit burdensome from a financial point of view, but at least is there to try to open those doors. But it's still a challenge. Megan, you guys are early, although I know you've had some discussions early on about restrictions and where you feel comfortable offering your services when those get started. Do you think that there's a wide enough expanse to ensure that your program can see at least the large? Well, you're in Texas, so it's a big state to start out with, but, to see light of day outside of Texas.
Yeah. I mean, I think most of us, probably not just on this panel, but probably on the call, and the reason they're listening is that it feels like we're doing something with telehealth in general that's really creating a good experience for customers, improving access. There's a lot of opportunity here, and I think that everybody would like to see that continue to open up even more. So I think that more availability for more populations is a good thing. You know, hopefully we'll see that continue to open up. You know, I'll mimic some of what Corey said, where children's is a little bit more conservative, right? So I think we have the same kind of mentality as Corey is talking about as well, for good reason, right? You know, I think we all want to be safe. We want to make sure that we're doing the right things in the right way. And while we're looking at new opportunities, we're being safe in doing so. But I think as we get more familiar with doing this nationally, this is going to continue to open up. I think that's going to be a great thing. I think we've seen that with the VA now, right? With how that's moving. And I think that we'll continue to see more groups of people adopt that. But I think, again, it's important we do it safely and we figure out how to do this right. So I imagine it will continue to evolve. I think we probably all see that, and that can only improve, to my, in my opinion, what we're able to do for different groups of people.
Yeah, it's great, and we'll continue down the line here, but important to note that VA has been a pioneer in this, and they just recently came out with some additional regulations which do free up doctors in general anywhere to work with the VA population. That's mostly not children, so not necessarily great for these hospitals, but there's a CHIP program which might follow suit with that. CHIP has been pretty active there. There also are small programs like HHS, Medicare, Medicaid, that ought to have the same kind of regulatory ability to do that. So we do have our fingers crossed. And the good part about this webinar is we have several hundred people on here who who might be advocates for this is advocate it. It is really important. This is a really important service, and I think there's never been a person that I've run into who has said, you know, I wish there was more restrictions on these. It's just not that way. These are important programs. Getting access to these really capable medical professionals is really important. So if you're on this webinar, make sure you talk to your congressperson or whoever you have to talk to make this work. Vanessa, we started off talking about this a little bit in your side, but are you guys going to be, do you think you're going to be able to bring this back in a US program? Is that something that you think is in the cards?
Yeah, I definitely think that it's something in the cards, something that we're working towards. UPMC Children's is really blessed with being a part of a bigger healthcare system with a geographic footprint that right now reaches Maryland and New York, as well as in Pennsylvania and across our state. So really our thought process is to try to work within our own, you know, home system as we look to branch out and grow bigger, of course, across the country. You know, we are not part of that Interstate Medical Licensure Compact Act, and maybe a blessing, maybe a curse, I'm not really sure. Maybe someday we'll get there. But I think more good things to come, as both Megan and Corey said. Slow and steady and safe is the way that we want to practice in all of this.
Great, thank you. And Laura, I know you guys are deep into it and
yeah,
continue to struggle through it.
I mean, I think near term, with a focus on access, we take sort of a glass half full approach, right? Maybe there are some states that we're not comfortable in, but that doesn't mean we can't serve, you know, 30 or 40 others. So I think we view this very much as trying to extend out where we can. The other piece of that is, you know, some physicians that have a really large domestic draw getting cross-licensed in states that it's important for them to have that licensure there. And I think the last piece is we're always going to work with that patient on their individual situation, right? Does it make sense for them to actually come to our institution to receive in-person care, and really talking through their specific needs to make sure we can do what we can do for them. Long term, I'm hopeful that similar to what we saw with, you know, both licensure regulation and coverage for ambulatory health, I'm hopeful that same shift we saw during COVID will eventually get there, right? I think it's not just licensure, but also the reimbursement pieces that we're all going to need to do advocacy and education around to try to bring everyone into that same vision.
Yeah, I don't know if we're going to get a chance to talk about reimbursement in this call. That could go on forever, but that is a bit of a sore spot. Maybe not a bit, maybe a very big sore spot in terms of the ability to offer remote second opinions. So important aspect of that. Okay, so what I'd love to do is just switch a little bit to the why. So, and for me, the why is, and I'm going to start with you, Megan, but you're considering putting together a virtual second opinion program as a part of what you do in telehealth all together at Texas Children's. What do you anticipate the benefits, or why is telehealth something, or second opinion specifically in telehealth, why is that something that you want to focus on?
Yeah, I think there's a lot of reasons. There's two that stand out right now. We're talking about a lot. And, you know, the panelists here can say the same thing, I think, in a sense of we are lucky enough to work with some really amazing physicians that can do some really incredible things. And if you think about what it means, so pediatric care in general, right? It's different than adult medicine in the way that there are often fewer simple cases with kids. There's usually something that needs some discussion, right? It helps to really have that specialist opinion and to have multiple people talking to each other. I think that becomes really, really important, especially in pediatrics. Being able to provide, you know, the best of the best wherever they are. Again, I think we all are lucky enough to have some of those. Being able to provide that access becomes really, really important to providing good care for children. The second thing is really thinking about how to provide that intelligently, right? So as we are all trying to open our doors, make sure that we are giving access to the people that need it. You know, resources are limited. So trying to figure out what we need to offer to have that maximum benefit for the best outcomes, but be thoughtful about the resources. It just becomes really, really vital to success, to long-term success. And I think all of us are trying to figure out how to kind of manage that space, right? And again, as there's so many options, it's figuring out when is which option the right thing for the right family, for the right child. So I think, in short, one is making sure that there's access to the best care for children. And then two, that we're being smart about how we're doing that.
Great. Vanessa, same question for you. What's the Holy Grail? Where's the place you're going with this?
Yeah, so I'm going to echo Megan's sentiments in that, like, one of our slogans here at Children's is to provide the best care for the most kids. And that's really where we're at. We are very lucky to have fantastic providers here from all over the globe. And so they have had their hand in the pot, perhaps in their home country, and people know their name and know their expertise, as well as people here domestically. So in order to provide that care and take care of kids, we need to figure out the most mindful but efficient way to be able to treat them. And so that's really where we're at. How can we take care and meet families where they're at in order to hopefully take some of the stress and the scariness of what they could potentially be dealing with off of their plate? How do we make this a better journey for them to make sure that they're getting the best care? And that's really what drives us.
Great, thank you. Laura?
Yeah, very similar. I think just giving this pathway and really paving it, right? Going from sort of the rocky road to a paved highway so that families can really efficiently get access, sometimes to very time sensitive, treatment advice, I think is critical for us to do within pediatrics, right? Thankfully, most children are healthy, but subspecialists are just so rare that, as we've highlighted, you might have to go to a certain state if you want to talk to that person. And we see this as a way of opening that up and really orienting ourselves to what the families need, rather than sitting in an ivory tower and waiting for them to come to you.
Great, thanks. And Corey, I bet you fit in a similar bucket to that.
Yes, I think we're all on the same page. One of the mission of Cincinnati Children's is to be improving child health, and it's not just for children in our own backyard, it's children everywhere. And this is a mechanism to make ourselves available to families who maybe previously wouldn't have considered Cincinnati Children's because of the distance. And so it allows us to become part of their consideration set as they are, as parents or family members of a child that has gotten a new diagnosis, or they're grappling with, is this the right treatment plan? It allows those families the access that they maybe otherwise wouldn't have had to our clinical experts to help guide them in making the best decisions for their children. So just very excited to be part of this work, and I think it makes me happy that others are also embracing this, because we all want the same thing. We want kids to get the care that they need.
It's great. And I'd just pause for a second and say, we're blessed in this country to have some of the finest healthcare in the world, and organizations like yours and people like you are making a big difference. So just a quick shout out to you guys for all that you do. With that, I want to change a little bit, although it's very related to the last topic and the answers that you gave. But we know that most children's hospitals are materially impacted by populations of low-income or disadvantaged children, families. So how do health equity considerations impact this and perhaps your other strategies in your hospital? We're asking people to pay for these things out of pocket. How do we deal with, and how do we balance that against health equity? And Vanessa, if you wouldn't mind starting out.
Sure. So I think here, I can probably speak a little bit better to this and what we're doing in person than in the telemed world. But in the world of technology, right, we try to guide our patients and our patient families toward services that are available. So here in the Pittsburgh area, there is partnership with Xfinity and Comcast, who are internet service providers. And we have a community resources team that just really try to link and connect to make sure that we are getting those underserved populations what they need. In the world of in-person, we have what we call the Care Mobile here, and it's like a gigantic bus that we go in, and it has exam rooms in it, and we go out to the community and take care of some healthcare needs that way. So again, back to, I don't know, I think everybody has touched on it a little bit earlier, meeting our patients with where they're at and understanding that just because we have the technology on our side, right, doesn't mean that it's super easy for the patient to get connected to us.
Understand. Great, thanks. Laura, how are you dealing with it at Nationwide?
Yeah, I think what we've seen really universally with telehealth is that the burden it places upon families, both logistically and financially, is significantly reduced. We've looked at the costs of travel to Columbus, right? If you were to have to take a flight, book a hotel, take time off work, which many families just simply can't afford to do. So we really view telehealth as a way to provide a more affordable option for patients to access our services.
Great, that's encouraging. Corey, how about what you're doing at Cincinnati Children's?
So when we think about health equity, I think most, or I shouldn't say most, but often it's thought of as just, you know, the financial aspect. But we've put great strides behind thinking about, are we providing the information to families in a language that they understand? Are we providing the instructions at a level that perhaps you have grandparents that are the caregivers for a child and aren't as familiar with technology? Are we alienating those care providers by not talking about telehealth in a way that is understandable for those who aren't as tech savvy? So there's lots of different ways to look at health equity, and at Cincinnati Children's is something that we are committed to continuing to improve on. And frankly, we're not where we want to be, but it's something that we're committed to continually working towards improving.
Great, thanks. And Megan, I know you've got lots of programs down there.
Yeah, well, you know, and I'll say as somebody from, you know, a very rural town in Minnesota, and I think the population probably had more cattle than people. You know, one of the really great things about Houston is that it is one of the most diverse cities in the country. And with that provides a lot of insight and opportunity, but also is something that we have to be mindful about. And I think Corey made a good point, right? Communicating in a way that's effective, that becomes really important. You know, Laura, I think, made some really insightful comments about really thinking about the cost of the experience as a whole. And I think how we're trying to think about it right now is taking all of those things that everybody has spoken to, right, and thinking about how that merges with technology. So instead of thinking about, you know, technology replacing some of the work that people are doing or people doing it without technology, it's really trying to find some of that human-centered design thinking, right, and think about how people and technology can merge to make something better. And one of the things that becomes really important in that, and while we're thinking about our community and you know, how to best serve them, it becomes flexible technology that seems to be the best answer, right? So trying to make sure that we're putting flexible tools into our experts' hands, our clinics' hands, patients' hands, so that we can be mindful about flexing in whatever direction we need to make sure that we're meeting the needs of that diverse population. So right now, really thinking about flexible technology so that we can meet those needs in the variety of ways that we need to.
Great. So one of the questions that most of the hospitals, specifically children's hospitals that we've talked with, have to overcome, the hurdle, if you will, is how do you justify this financially? So there's an investment that you have to make in people, technology, and probably training as well as personnel. And ultimately, hospitals have to generate sufficient revenue to stay in business. Is there a specific challenge that was posed to you that was difficult, or is there a general rule that you had to follow in your programs to make that happen? And Laura, you're first on my list on this one.
Yeah, I think what we found as we were initiating this program is patients and providers were doing this in various ways today, right? So the financials, prior to trying to systematize this, were really just unaccounted for. So I don't think the investment is all net new, right? When you talk about staff, you might find that there are nurses serving in certain functions today. So we really looked at the patient experience, the provider experience, and the efficiency that we would gain, rather than trying to tabulate everything, because in today's world, you probably have some folks that are doing this and it's just not accounted for.
And let me just follow on with that one before we go around. So physicians are pretty busy these days, and this feels like you might be layering on yet another responsibility. How are you dealing with that in your organization?
I think we're starting with the physicians that are asking for this, and we have a number of those where they're eager for a solution. Again, they have ways that they're communicating today with patients that aren't ideal. So we're starting with the physicians that are eager, that we think are going to be strong adopters. And as we expand and scale, I think we're going to be using those physicians as leaders, and that's the best way to convince a physician to do anything, is when their peer is doing it and they get a little bit competitive. So that's our approach.
Great, thank you. And Corey, same question for you, and start with the hurdle part of it, and maybe I'll throw in is there a return on investment expectation from this as well?
I would echo some of what Laura said, is that we found that informally, and in a non-standardized fashion across the medical center, different programs were already offering this service, but there was no standardization. I hate to use the word inefficient, because it probably was efficient in certain ways, but standardization is always a good thing, I think. I shouldn't say always, but it has been a good thing, and it's really allowed us to make sure that we were able to take some of the heavy lifting of an online second opinion, which is the records collection. We were able to take that off of clinical staff, and our partners, Purview is who we work with. We have case managers within Purview that have taken on that work, so that we're making sure that our clinical folks are working at the top of their license to, and I think, so there's trade-offs. Are there new costs associated with it? Yes. But at Children's, we always try to do things because it's the right thing to do, and this is the right thing to do. Leadership is very supportive of this. We understand that this is something, there's a great need for this in pediatrics, and we wanted to make sure that we were able to deliver on that. I know, Les, you asked me a second part of a question, but I'm going to have to ask.
Is there an ROI, return on investment expectation from this?
I wouldn't say there's an expectation. Of course, there's always a desire for there to be a positive ROI. I will say that one thing that we've learned is that, in how you measure the success of a program is, I really think that it's how many, I hate to use this term, it feels a little crass, but how many leads are you generating from having this program? And we've had cases that have not been clinically appropriate for an online second opinion, but a family wouldn't have otherwise known about us, that we were then able to make sure that they were connected with the right folks in the hospital, and they've since come and been seen and become patients of the hospital. So there's downstream revenue. We've had a patient who converted from a completed online second opinion. Naturally, yes, from a business perspective, that is our desire. But at the end of the day, we really want to make sure that families are interacting with us in the most appropriate manner to get their need met, I should say.
Great, thank you. Megan, again, it's early stage for you, but are you being confronted with things in terms of what this will bring to your organization?
Yeah, I mean, I think we can mirror all of the things people said thus far. You had mentioned thinking about providers' time. And it often feels like even if we find a more appropriate space for a patient, right, or open up templates or something, like there's more, unfortunately, there's more than enough business to keep filling up our templates, right? There's not really, it doesn't feel like if we continue to dig in that hole that we're gonna like reach the bottom of it at some point. So really it can feel like we're asking people to just do more and more and more all of the time. And I think what we're thinking about more intently is how can we make it not feel that way, right? And I think that as telehealth in general grew and became more popular, that burden that different providers felt became more significant. And that's something that we want to avoid and be more thoughtful of, right? But it's not something that we want to address by saying, well, we want to compensate the provider by raising the cost for the patient, right? So we need to be a little bit more creative. So we're having a lot of conversations in that space.
Great, thank you. And Vanessa, how are you doing with that at UPMC?
Our journey is very, very similar to Laura and Corey. You know, we had a little bit of everything happening behind the scenes and felt that there was a need to streamline it, bring it all together, and make it make sense for everybody involved. As far as return on investment, I don't know that we're looking, you know, we're certainly not looking to make millions of dollars. It's not about that. It's about opening up the patient access, getting these kids in front of the expertise and get them taken care of, right? And in a system like UPMC, actually, you know, we're lucky enough that if we get them as kids, chances are with the right care, the right control, we have them for a lifetime because we spread into the adult world as well. So, you know, just trying to make the most of what we have in front of us and, you know, understanding that physician time is limited, but this can create efficiencies when it's done right.
Great, thank you. So I'd like to pose one more, what I'll call prepared question to the group, and then we're going to open it up for questions. There's already some questions, a bunch of questions that are coming in. But Corey, I'm going to start with you, please. And I'm just going to ask open-ended, do you have any advice for people in the audience who are embarking on this journey? Many of the people that answered the poll are very early stage in looking at this. And I know you've been through, you've plowed a few roads yourself there. But any advice you can give to the audience for that?
Yes, there's two big learnings I think that if I could go back and tell myself prior to launching, one is to make sure that you really identify your clinical champions. And not to say that we didn't do that, we certainly did. But as we were building our program, things happened rapidly. And I didn't have a lot of visual examples to guide the clinicians through it, to say this is what it's going to be like. And you know, clinicians are human just like we are, and people tend to fill in the blanks when it's not explicitly laid out. And if I could go back, I would have armed my clinical champions with more specifics to help tamper down those concerns that were really unfounded. But now that we've had providers that have done second opinions, they can go back and say it's really not what you're thinking. It's not this huge extra burden, and they don't take as long as you think. I would say don't underestimate the importance of arming those clinical champions to really help you get people excited about it. And then secondly, not to take up too much time, but I think this is important too, is that that I also underestimated was you have to very clearly define for not just patients and families, but your internal audience as well, the difference between what your online second opinion offering actually is versus other telehealth offerings. We had quite a bit of confusion, even though we did address that in our materials that were directed to families and on our website. There was still quite a bit of confusion that we've since corrected or attempted to and put things in place. Like we now have our intake coordinator make sure that they talk to the family to make sure they're understanding what is the family's expectation. because we certainly don't want a family to be expecting a telehealth video visit-like experience, because that's very much not what they're going to get from an online second opinion. And we found that by having it written in several places, but also having that conversation helps families. We're managing their expectations so that they understand what they're getting, and ongoing conversations with our internal partners as well has helped pull people along so that they understand what the differences are.
Thank you. Megan, I'm going to turn to you next. Advice? I know, again, you're early, but I know you've been through a bunch already.
Yeah, I mean, we're moving along. I know we're taking up a lot of your time as well, so thank you for that. But no, I think the biggest thing, and I don't think it's limited to telehealth, second opinions, or anything like that, but one of the things that has been really important on this journey for us has just been looking to our community and then looking to other organizations to help us understand what best practices might look like, right? And I think one of the great things about working in healthcare, right, is we're all trying to make the business work, but at the same time, the reason that we're doing that in healthcare is because we enjoy helping people, and that extends to each other. So I'll say, you know, Corey, our team and myself included, we spoke to you early on to talk and just learn from what you all had done. Vanessa, UPMC in many ways, right, is I have my different organizations that I look to as different models for things, and really the network that you all have built is incredible. And Laura, we look to you all the time, and I know have lots of conversations. So I think having those relationships and learning from each other and helping each other move this forward, as we've talked about, there's so much room to grow and so much opportunity to do this better, smarter. I really think those relationships and helping each other learn together just becomes really, really vital.
Great, thank you. And again, credit to all of you for being willing to share, including on this webinar, but thanks. Vanessa, thoughts, advice?
Yeah, so I would start by saying anybody, you know, just getting their toes wet or starting their journey, Megan, happy to talk anytime. You know, it's an evolutionary process, and try to keep that perspective as you go through it. You need to build a strong foundation, have good bones to your project and your program, but knowing that the technology is changing all the time. I can tell you where we're at today, not just in second opinion, but in our video visits, is worlds different than we were even 2 years ago. You know, so I think it's important to remember to it's not always black and white. It's not always straightforward. And, you know, to speak to Megan's point, right, reach out to your colleagues and find out, hey, is this different in your world? Because if you're not asking those questions and you're just staying, and if you just kind of have tunnel vision about it, I don't think you're going to get the most robust program that you can get. So, you know, I just encourage everybody to remember that it's evolutionary, and, you know, be willing to roll with the punches and go with the changes as they come along.
Great, thank you. And Laura, you want to sum up from your side, some advice?
I'll echo what Corey said pretty closely. I think including your clinician leaders from the very start, we included ours in vendor demos, right, and really making them feel like they were leading this, because it's ultimately their needs and patient needs that are driving outcomes, I think is really critical. You know, we're all sort of in the telehealth and virtual care space, but I think if you approach this from like a technology perspective, you're probably not going to come out with the right solution. You really need to understand the patient experience piece. The technology is there, right? There are vendors out there that can do this, like Purview and others. But you need to build that experience around the technology to make it successful, and really to ensure the adoption on the back end, and make sure that your docs are going to use it.
Great, thank you all for that. We've got a lot of questions from the audience. We're not going to get a chance to go through all of them. I'm going to pick a few out. I'm going to just toss them out to the four of you, and if somebody feels passionately about answering it, please do. If you don't, that's okay as well. So one of the questions was, what's the top specialty that you've focused on, or the top specialties that you focused on for delivery of second opinions, or do you do it broadly across all of the specialties within your organization? Any of you can just jump in.
I'll start. I think this depends on where you're drawing domestic and international patients today. So for us, you know, we have a pretty significant destination program around HEMONC, around our colorectal group, our neurosurgery group. So looking to those groups where you have, you know, preeminent expertise in that field, I think is a great place to start.
Great. Okay, I'm going to jump to another one then. Are your telehealth and second opinion, telehealth, digital health, and second opinion, do they all report in the same to the same organization within your hospitals?
Yes, here at Children's, yes. We do have a separate group that does oversee the adult population, but here at Children's, all rolls up to one.
Okay, great. Question came up, do you each have state Medicaid contracts for reimbursement? Not sure if that applies to remote second opinions, but it's a question. Okay, we're going to leave that one blank for now. No problem. Let's see. How are you addressing the documentation burden being placed on your providers when you add these additional encounters to their day? Is there a way that you optimize that?
Corey, I think we actually asked this question of you, so I'm absolutely going to throw you right to the front of this question because we had this conversation.
Yeah, this is one of those worst case scenario things that I think our providers were filling in the blank of, is that it's actually, the requests are much more targeted. It's not tell me everything you've ever learned about XYZ condition or treatment. It's my child has this. This is what we're doing. This is what's happened. These are our questions. The providers only need to address those specific questions. So it's not, you know, it's however verbose they want to be in responding to those questions. The main, at the end of the day, we just want to provide those families the answers to the questions that they have. So it's not as overly burdensome as I think providers are worried that it might be. At least that's been our approach.
Yeah, it sounds like in general, there's a lot of unknowns at the beginning, and that is scary for lots of parts of the organization. So just getting down to the brass tacks of it is not nearly as bad as it looks. Then I'm going to give you one last question that I got from the audience, which is, are your second opinions restricted to a single discipline, or is there an opportunity for a multidisciplinary review in something like an oncology case, for example? Laura, you're shaking your head. You want to?
Yes, we do offer multidisciplinary review when it's needed.
We do as well.
And is it different? Is there anything different about that than a standard second opinion?
Not for us, other than the clinical faces it touches.
That's true for us as well.
Okay.
And I can, it's on our short list of I think we, you know, to speak to a first question, we're looking at heart quite closely because, you know, to Laura's point, we have a lot of demand there and we have a lot of expertise there. And that often requires multidisciplinary review. So it's something that's very high on our list as well.
Great. Okay. Well, I promised we would get done by 3 o'clock Eastern. And so we are about 3 minutes short of that. And I think we're going to give everybody a 1 or 2 minute snow minute so they can take off the rest of the time. I just wanted to thank our panelists deeply. This is just great. You guys are, you're troopers to do this work. You're great at what you do. Your hospitals are wonderful, and your willingness to share with your colleagues is superb. So thank you very much. Thanks for joining with us today. Thanks for sharing with this audience. From a Purview point of view, we've got a few, as I said, parting gifts for people that have attended. We've got some articles, Second Opinions 101, which we'll send to you. That was written in conjunction with the advisory board, which is a pretty cool industry advisor. We've got Welcome to the Virtual Front Door. Actually, that's an article I just wrote on how a virtual front door might be the front end to telehealth and or an in-person visit, including second opinions. And we've got our next webinar event, which is the special case of orthopedic second opinions, and that's scheduled for, well, how appropriate. We're going to talk about orthopedics, skeletons come to my mind, just before Halloween. So that's on the 27th of October. But anyway, thank you very much for joining us. This webinar has been recorded. We'll provide that to you. And thanks again to our panelists.
Thanks, Les.
Thanks, everyone. Have a good afternoon.
Thank you.